Hyperglycemia. Hyperglycemia refers to a condition characterized by high blood sugar levels, specifically elevated levels of glucose in the bloodstream. It is most commonly associated with diabetes, both type 1 and type 2, but can also occur in other medical conditions or as a result of certain medications or lifestyle factors. When we consume food, especially carbohydrates, our body breaks down the carbohydrates into glucose, which is the primary source of energy for our cells. Insulin, a hormone produced by the pancreas, helps transport glucose from the bloodstream into the cells to be used as energy. In people with diabetes, there is either insufficient insulin production or a reduced ability of the body to respond to insulin, leading to elevated blood sugar levels. Hyperglycemia can have various symptoms, including frequent urination. When blood sugar levels are high, the kidneys work to eliminate the excess glucose through urine, leading to increased urination. Excessive thirst. Frequent urination can cause dehydration, leading to increased thirst. Fatigue. The body's cells may not be able to effectively utilize glucose for energy, resulting in fatigue and lack of energy. Blurred vision. High blood sugar levels can affect the lens of the eye, causing temporary changes in vision. Increased appetite. Despite having high blood sugar levels, the cells may not be receiving enough glucose, leading to increased hunger. Slow healing wounds. High blood sugar can impair the body's ability to heal wounds and fight infections. It is important to manage hyperglycemia. If left untreated or uncontrolled, it can lead to complications such as diabetic ketoacidosis, DKA, and people with type 1 diabetes. Or long-term complications like cardiovascular disease, nerve damage, kidney damage, and eye problems in both type 1 and type 2 diabetes. Treatment for hyperglycemia typically involves managing the underlying cause, which may include diabetes medications. People with diabetes may need to take insulin or other anti-diabetic medications as prescribed by their healthcare provider to help regulate blood sugar levels. Lifestyle changes. Adopting a healthy lifestyle is crucial. This includes following a balanced diet, engaging in regular physical activity, maintaining a healthy weight, and managing stress. Blood sugar monitoring. Regularly checking blood sugar levels using a glucose meter can help individuals with diabetes track their levels and make necessary adjustments to their treatment plan. Insulin therapy. Individuals with type 1 diabetes or some cases of type 2 diabetes may require insulin therapy to regulate blood sugar levels effectively. If you or someone you know is experiencing symptoms of hyperglycemia, it is important to seek medical attention. A healthcare professional can provide appropriate diagnosis, guidance, and treatment options based on individual circumstances. Hypoglycemia. Hypoglycemia refers to a condition characterized by low blood sugar levels, specifically a drop in the concentration of glucose in the bloodstream. It most commonly occurs in individuals with diabetes who take certain medications such as insulin or oral hypoglycemic agents, but it can also occur in people without diabetes under certain circumstances. When blood sugar levels drop too low, it can impair the normal functioning of various organs, including the brain, which relies on glucose as its primary source of energy. The common causes of hypoglycemia include diabetes medications. Certain medications used to treat diabetes, such as insulin and some oral hypoglycemic agents, can cause blood sugar levels to drop if the dosage is too high or if it is not balanced with food intake or physical activity. Delayed or missed meals. Skipping meals or delaying meals for an extended period can lead to hypoglycemia, especially in individuals who are taking diabetes medications. Excessive physical activity. Engaging in intense or prolonged physical activity without adjusting diabetes medications or food intake can cause hypoglycemia. Alcohol consumption. Drinking alcohol, especially on an empty stomach or in excess, can cause hypoglycemia. Alcohol can interfere with the liver's ability to release stored glucose into the bloodstream. Certain medical conditions. Some medical conditions, such as certain hormonal deficiencies, liver or kidney disorders, or pancreatic tumors, can lead to hypoglycemia. The symptoms of hypoglycemia can vary depending on the severity and individual response, but common signs and symptoms may include 1. Shakiness or trembling. 2. Sweating. 3. Rapid heartbeat. 4. Anxiety or nervousness. 5. Hunger or increased appetite. 6. Weakness or fatigue. 7. Headache. 8. Confusion or difficulty concentrating. 9. Irritability or mood changes. 10. Blurred vision. 11. Dizziness or lightheadedness. 12. Tingling or numbness in the lips, tongue, or other parts of the body. If left untreated, severe hypoglycemia can lead to loss of consciousness, seizures, and in rare cases, even coma or death. If you suspect you are experiencing hypoglycemia, it is essential to take prompt action to raise your blood sugar levels. This can be done by consuming fast-acting carbohydrates such as glucose tablets or gel, fruit juice, regular soda, or candies like glucose tablets or hard candies. It is important to follow up with a healthcare professional to determine the underlying cause of hypoglycemia and adjust the diabetes treatment plan if necessary. If you do not have diabetes and experience recurring episodes of hypoglycemia, it is recommended to seek medical attention for proper evaluation and diagnosis, as it may be a sign of an underlying medical condition that needs attention. Methods to check blood glucose. There are several methods available to check blood glucose levels. Here are some common methods. Blood glucose meter, this is the most common and widely used method. It involves pricking your finger with a lancet to obtain a small drop of blood, which is then placed on a test strip. The test strip is inserted into a glucose meter, which analyzes the blood sample and provides a digital reading of your blood glucose level within seconds. Continuous glucose monitoring, CGM, systems. CGM systems use a small sensor inserted under the skin to measure glucose levels continuously throughout the day and night. The sensor sends the readings to a receiver or smartphone, providing real-time glucose data. Some systems also have alarms that can alert you to high or low blood glucose levels. Flash glucose monitoring, FGM. FGM systems work similarly to CGM systems but do not provide continuous glucose readings. Instead, you scan a sensor placed on your skin with a reader device or smartphone to obtain a current glucose level and a trend arrow indicating the direction your glucose is heading. Urine glucose testing. This method is less common nowadays but can be used in certain situations. It involves using a test strip to check glucose levels in a urine sample. However, urine glucose testing is less accurate and may not reflect current blood glucose levels. Laboratory-based tests. Blood samples can be taken and sent to a laboratory for analysis. These tests, such as fasting plasma glucose, FPG, or oral glucose tolerance test, OGTT, are usually performed in specific situations, such as diagnosing diabetes or monitoring specific conditions. It's important to note that the choice of method may depend on factors such as personal preference, the frequency of glucose monitoring needed, the accuracy required, and your healthcare provider's recommendations. It's always best to consult with a healthcare professional to determine the most appropriate method for your specific situation. If you find this video helpful, please hit the subscribe button for my channel. Thanks for being here!